Okay, so I will go then now for our last speaker, Mike Downham from Zero COVID Scotland campaigner. So please, the mic is yours. Thank you.
Thank you, Carmen. First, I want to take this opportunity to explain to the election candidates with us today why working with others to eliminate the COVID virus from Scotland has become a top priority for me personally, why it gets me out of bed in the morning. A neighbour said to me recently, "This is no way to live," going on to say that she thought this was equally true during lockdowns or when we're facing the possibility of future surges of infection and further lockdowns. That rang true for me and set me thinking about all the different ways in which this epidemic has made life difficult for people, especially the ways I can identify with because I've to some extent experienced them. For example, I feel I can speak to some extent for those who have died and for those who grieve for them, having lost two close friends in the early days of the epidemic. As a retired children's doctor, I can speak for children who, because they aren't being vaccinated, are at high risk of infection, an infection which sometimes results in severe illness, and even if it is less severe, can take them a long time to recover from. For all we know at this point, some of these children may have had their health permanently damaged. I feel I can speak too for young people, as I see my grandchildren leaving school with very few job opportunities, educational options which are expensive and carry a high COVID risk, and with no chance to travel. As a one-time junior hospital doctor, I can speak for the exhaustion of frontline workers. The workers, for example, not only in hospitals, but also in care services, delivery services, and many other sectors. I can speak for the grandparents unable to share in the care and upbringing of their grandchildren because I miss that more than anything. I can speak for the grandparents too, whose families are scattered across the world, thanks to Britain's imperial past, because I have a son in Canada and a granddaughter of 10 months there whom I've never met. There are others I can't speak for because I've been more fortunate than them, the people who live on their own, for whom loneliness has become a sometimes unbearable burden. There are those who weren't able to get their cheap winter fix of sunshine to compensate for oppressive jobs and poor housing, and there are those whose health care has been undermined by an overburdened NHS. But what most of all concerns me is the talk of getting back to normal by the summer. When asked this week whether he thought there would be a third wave, Dean Pillay, Professor of Virology at University College London and a prominent member of the Independent SAGE Committee, predicted that without a change in strategy by the governments across Britain, many of us might indeed get back to a so-called normal life again. But he was clear that there would be a large number of people for whom life would be even more restricted and devastating as new waves of infection hit them. There are many people who are less well off, who depend on bad jobs and bad benefits, who have physical vulnerabilities, including long COVID, those who live in overcrowded, poorly ventilated homes, and those who have not yet been vaccinated, often because they don't have access to the best information. I confess that the prospect of a still more unfair and divided society keeps me awake at night. And yet, another far better future is entirely possible for all of us, and it's simple. There is a tried and tested method for eliminating viral or bacterial epidemics, which in this pandemic has been catchily, but somewhat misleadingly named Zero COVID, and which has been successfully used by other countries, including the Atlantic provinces of Canada, Iceland, New Zealand, Australia, Taiwan, and Vietnam. It consists of 5 things. First, comprehensive restrictions, no half measures, in zones where case levels are high until case levels have been brought down to a safe level, zones which have achieved low levels of infection coming together as bubbles. Second, workplaces, each of which has been made safe for workers and users before opening, and schools, colleges, universities, and public transport are all workplaces. Third, a find, test, trace, isolate, and support system entirely within the public health service with the capacity to act quickly and comprehensively enough to stamp out new outbreaks. Fourth, support, financial, practical, and emotional, for each person asked to self-isolate according to their needs. Fifth, prevention of new cases and new variants from being imported across the boundaries between red zones and green zones, as outlined by Andrew. Finally, a word about vaccines. People have been encouraged to think that we'll be safe now we have the vaccines, but for 3 reasons this just is not true. The vaccines are really important because in most people they will thankfully reduce the severity of COVID illness, but they are very much less effective in preventing spread of infection. The second limitation of vaccines is that sooner or later variants resistant to them will emerge unless we at the same time use the other ways we know about to reduce levels of infection. Third, there are many people who can't be vaccinated, including children and people with weakened immune systems, and there are the people who choose not to be vaccinated, and to date, only 15% of people in Scotland have been fully immunised. Vaccines are not a replacement for a comprehensive public health approach to the epidemic. But if they are used in conjunction with the other 5 public health measures of the Zero COVID strategy, they can make a highly significant contribution. At a global level, Scotland must stand up for vaccines for all. It's true that no one is safe until everyone is safe. So my parting question to the 3 candidates today is, if you are elected to become a member of the Scottish Parliament on the 6th of May, will you take every opportunity to argue that we need to vaccinate while we eliminate?
Thank you, Carmen. Absolutely, Mike. Yeah, I said earlier on that people, vaccination is very, very important. But what we need to make sure is we are eliminating as we go along and putting the right measures in to make sure we are safe. Now, going back to talk about the fact that the UK government have secured 457 million potential dosages, and I think we should be proud. We've mentioned a lot of the good things of the NHS and everybody else today. We should be proud of the fact that our scientists and technicians have created vaccines from such a short period, and the fact we've signed a deal now in the Lothians that we've got a place there that they're going to start manufacturing from. And I think looking at that, we have now what we didn't have a year ago where we are today. We have so much in place, but we mustn't be complacent at all, because the vaccine, it's not basically a cure that and it won't stop at different variants either. So I think that, yes, I agree with you. It's great we've got the vaccine there and the rollout's really, really good all over. I mentioned the statistics earlier on, but we need to make sure we're monitoring it, and not just monitoring it, to see if the vaccine goes up and down and where there's more deaths and where there's more spread. I think we need to also look at the variants coming in, not just what we have in Scotland or in the United Kingdom, but also, like I mentioned earlier on, like India's variant that they're, that's going on. That we need to see what's happening around the world as well to make sure how we can keep ourselves safe here. But in the meantime, we do need to return to some some sort of normality, if that's the right words. And I would say that people will open their businesses, people will go back to work. Children's education has suffered so much. Children have gone back, you will be able to go into care homes, other places to see your elderly. People will start meeting outside, but all this must be taken. Be cautious. People have to be cautious. We have ownership on ourselves here, Onesies, that when we go out, I certainly know that I'll wear my mask, and what I do, I think we all have a duty of care, not just to ourselves, but also people around us. So I'm going to round it off by saying, yes, meantime, normality, some will return, with the vaccines. But Mike, I agree with you. We need to keep an eye on things, and looking at the areas you've talked about, the 5 public measures, we need to keep looking at them and making sure that when they're embedded at the right times, when the people that are experts, like I said, I'm no expert, that they come forward and they let us know. But on this call, I just want to finish by saying we've got a big task ahead, and independence is not the way forward. We're fighting a pandemic here. So I don't agree with the Greens and the SNP talking about independence in any way, whether it's border controls. Let's work together to make sure we get through this pandemic. And that's really my ask for everybody from the Scottish Conservatives. Thank you for listening today. And thank you. I hope I've answered all your questions. Thank you.
Thank you, Pam. Thank you for your answers. And we are taking next Maggie from the Green Party. Maggie, please.
Thanks, Carmen. And Mike, thank you very much for your contribution. I think getting back to normal is a hideous idea, and it's nothing that I can contemplate really at all. We know that vaccinations are not a panacea. Aren't going to solve everything, as you say. That they don't necessarily prevent all spread. They don't deal with resistance. And I mean that one of the points you made, no one is safe until everyone is safe. I think that really highlights the public health element of this. This isn't about it's not about individualizing the problem. This is about taking a collective measure to keep all of us safe. And that means that our civic and state institutions need to be taking this really, really seriously. So yes, absolutely, I will speak out at any opportunity. I will use my voice to argue that we need to be doing much more on lots of different areas. There are areas that we know we need to transform that are not currently the responsibility of the Scottish Government, things like changing sick pay, furlough, borders, and so on. I want to be able to do more on that, and I will keep arguing for that. And I think we need to make sure that when we talk about elimination, this isn't about making things better for the economy. This is about making things better for humanity and for people. So, you know, the UK government appears to think that eliminating COVID will show that the economy is you know, can cure all, can ride everything out. But we know that elimination is actually a much bigger thing. It is for all of us. And I think globally, we need to make sure that we convince governments around the world. We need to use whatever voices we can to argue that. So wealthier countries like the UK and Scotland should be supporting equitable international access to vaccines by increasing their financial contributions to COVAX, to the COVAX initiative, sharing excess stockpiles of vaccines, and making sure that less wealthy countries actually have not only the vaccines, but also the broader public health support measures in place that are needed, and resources. So there's something about Scotland being able to play a really, really important part in not only our discussions with the World Health Organization, but contributing in areas where we know we already have partnership work. So like Malawi, and I think looking at this as a global issue is what will make sure that we vaccinate and eliminate.
Okay, thank you very much, Maggie. I will take the last member of the panel to answer. Graham, no, not the last one. Graham, please.
Thank you, Carmen. I will going to start by saying I'm a supporter of the Zero COVID campaign because I believe in the strategy. And I want to make sure that we are pursuing an elimination strategy, because otherwise the widespread presence of the vaccine throughout the population is not going to work. And the reason why it wouldn't work is because we already know from down south that mutations and variations seem to be developing some degree of resistance to the most widespread vaccines that we've already got amongst the population. Now, people may not die when encountering it in the same numbers, but they'll still be ill, they still can get long COVID, and there'll still be disastrous social and economic effects if we rely solely upon the vaccine. And indeed, only one vaccine. Why only one? There's obviously several which have been developed, including the Valneva one here in Scotland, which is coming on stream. Scotland needs to be part of the global solution to curing this pandemic, which means making these vaccines available to the whole planet, because until the whole planet is immunized, we will keep getting mutations and variations which will eventually become immune to our vaccines. So that is why an elimination strategy is necessary, because only with that can we actually have a situation where there is no virus in the population. We should not be using our population as a test bed, a sort of a laboratory for the preparation of future vaccines and all that. It should not be necessary if we have an elimination strategy which kills the presence of the virus. It's worked in New Zealand. It's worked in countries like Taiwan, where they're back to a sort of normal. Now, I'm of the view that we shouldn't go back to that normal, because that normal wasn't very good, as Fiona and other people have pointed out, it wasn't great for disabled people before. It's even worse now. So if we go back to that, then we'd be completely failing to learn the lessons of this pandemic and the inequalities that it has exposed, in particular for BAME health workers and BAME populations, as we know that their likelihood of dying and contracting this disease is much higher. Their vulnerability to misinformation campaigns about the safety of vaccines as well, that has led to a decline in uptake of it. We need to urgently save those people's lives by making the vaccine available for everybody. But I'm fundamentally in favour of that elimination strategy. If I'm in Parliament, the first thing I'm going to do is have this hearing in the Parliament. I will be inviting Zero COVID Scotland to have this hearing in the public arena in the Scottish Parliament.
Thank you, Graham. Thank you very much for your response. We are taking the last Paul Sweeney, please, from Labour Party. Thank you.
Thanks. A lot of agreement with previous speakers on what they've said. I think it's clear that the initial sort of herd immunity, living with the virus concept was a disaster, which has led to over 100,000 deaths across Britain, one of the highest per capita death tolls in the world. And we know that was because of a tension amongst, well, largely within the Conservative Party about libertarianism versus, public health imperatives. And the irony is that, of course, not only did it result in a public health disaster, it resulted in the deepest economic recession for any major economy too. So it was a self-defeating exercise. And we've seen a controlled example where it has been outlined countries even significantly poorer than Britain, such as Vietnam, have effectively adopted the key zero COVID strategy and have, as a result, had the lowest death tolls and the least economic disruption as a result of the pandemic effects. So I'm fully subscribed to the zero COVID principles. I mean, they're just the fundamentals of good public health that have previously tackled significant endemic disease across the world, infectious disease. And I think we need to look at this where we have a serious lockdown, not a sort of partial lockdown or a compromise lockdown that is tolerable to backbenchers in the Parliament. We need to have a situation where there is a degree of infection. It's driven, whereas all non-essential workplaces are closed. We have an effective and robust test, track and trace and isolate system that has got legal backing to force people to self-isolate, but not just legal backing, but also has sufficient financial and social security support to ensure that people are supported. That's part of the problem, is people can't afford to take time off work because our statutory sick pay is so miserable. So we need to look at powers where we can enhance social security in Scotland to deliver a more stable and secure basis for people to take that kind of action, where we aren't, creating these perverse incentives to sort of open up places early, such as schools. We're putting people at risk as a result of that. We also need to look at the border aspect, using the public health powers in the 2008 Act to improve border resilience in Scotland and create a better and controlled environment. But I think the point that Maggie made as well about international solidarity is critical. If we allow this to rampage around the world, then we're eventually going to end up with a situation where mutations may well totally snooker the vaccine program and render us back to square one. So we need to have a situation where the global south are catching up with the west on vaccinations. The rate in Africa, for example, is disgracefully low. And we've obviously seen impacts on the supply chain in India. So we need to look at a global approach to waiving vaccine patents to try and ramp up global production as much as possible. And I think we've seen this kind of beggar thy neighbour protectionism creep in as well, which is extremely unhealthy. So that's another element that I would like to look at promoting as well. But I think there's clear measures to introduce the 5 themes that were discussed to move us further forward in Scotland so that we are eliminating whilst vaccinating.